Hello guys, welcome to Dr. Science. So today our topic is regarding the Otitis Externa. In this topic I'll be mainly talking about the different types of Otitis Externa, and not only that, we will talk about their treatment. So let's talk about the definition first. So here is the pinna and here is your external auditory canal, which will eventually fuse with the tympanic membrane. So any infection in the pinna or any infection in the external auditory canal will lead to inflammation, and this inflammation is called as your otitis. Otitis means inflammation, and externa means when it involves the pinna. Here is the pinna or your external auditory canal is called as your externa. So inflammation of the external part such as your pinna or external auditory canal is called as your otitis externa. I hope you are clear with this definition. Now let's talk about the different types of otitis externa. So otitis externa is divided into two types. One is your benign type and other one is your malignant type. So as the name suggests, malignant is more serious compared to the benign type. I will talk about malignant otitis externa in my next video. For today we will talk about the benign type. Okay, so benign is again divided into two types. One is your localized type and the other one is your diffuse type. Let's start with localized type of otitis externa. Once again, here is the pinna and here is your external auditory canal, which will fuse with the tympanic membrane. So this external auditory canal is divided into two parts. One is your outer part. This part here is your outer part, which is made up of cartilage. Okay, and here is the inner part. The inner part is made up of bone. So once again, the external auditory canal is made up of outer cartilaginous part, which constitute nearly 8 millimeters, and the external auditory canal, the inner part is made up of bone, which constitute about 16 millimeters. So in total, the external auditory canal is 24 millimeters. Okay. So in localized type of otitis externa, what will happen? We will try to understand. So this is the pinna and we are going to draw only the cartilaginous part, which is 8 millimeters. Okay. So in the cartilaginous part of external auditory canal, we have these hair follicles. So these are the hair follicles, and these hair follicles have certain glands which produce wax. These glands which produce wax are called as your seminiferous glands. Okay. So imagine there is a bacteria called as Staphylococcus aureus, and Staphylococcus aureus will infect these wax producing glands, and thus that condition is called as your furunculosis. So in furunculosis, the Staphylococcus aureus is going to infect these wax producing glands, and this will lead to localized type of otitis externa. So one of the cause of localized type of otitis externa is Staph aureus. Not only that, so once again, here is the pinna and here is the cartilaginous part of external auditory canal, and here is the bony part of external auditory canal. So in the cartilaginous part, some people may have fissures. In the cartilaginous part, some people may have fissures. These fissures are called as your fissures of Santorini. Now, what is the clinical significance of these people who have these fissures of Santorini is present in the cartilaginous part? Unfortunately, the parotid gland is sitting below these fissures. Okay. Now imagine there is infection in the parotid gland. When there is infection in the parotid gland, this infection can travel to the cartilaginous part of the external auditory canal and cause localized type of otitis externa. So another cause is that pathological defect known as the fissure of Santorini can lead to localized type of otitis externa. Not only that, some people in the bony part have fissures. If the fissures are present in the bony part of the external auditory canal, they are called as fissure of Husky, which are present in the bony part compared to the cartilaginous part. Okay, I hope you are clear with this part. So what are the main causes? The first cause was Staph aureus leading to furunculosis. The second was a pathological defect causes fissure of Santorini, can also lead to localized type of otitis externa. Now what is the treatment in this patient? The treatment is very simple. We give ictamol glycerin packing. Now what is this ictamol glycerin packing? We'll try to understand. So here is the pinna and here is the external auditory canal. Now this guy is having inflammation or infection in the external auditory canal. Now what we are going to do, we will take a gauze piece and we will dip the gauze piece in ictamol glycerin and keep it inside the ear. Okay. Now what this ictamol glycerin does? Ictamol is an antiseptic and glycerin will decrease the edema in this patient. So that is the treatment of this patient. And not only that, we will give antibiotics. So what is the treatment for this patient? One is ictamol glycerin plus antibiotics for localized type of otitis externa. Now let's talk about the diffuse type of otitis externa. In diffuse type of otitis externa, it is similar to the pathology is similar to localized type of otitis externa, but unfortunately these patients not only involves the external auditory canal, they also involve the pinna. Hence it is called as diffuse type of otitis externa. So diffuse type of otitis externa is when there is involvement of the pinna plus the external auditory canal. So this is commonly seen in swimmers, hence it is called as your swimmer's ear. Now I will talk about the malignant type of otitis externa in my next video. Thank you guys.